The image quality to a Clarius is on par or superior to many of the cart-based systems. My name is David Rosenblum. I'm the Director of Pain Management at AABP Integrative Pain Care, Maimonides Medical Center, and I run the NRAP Academy program, which is a continuing medical education program that focuses on board review, ultrasound training for pain physicians and any clinician or anesthesiologist who wishes to integrate ultrasound-guided pain procedures into their practice. I use the Clarius ultrasound for joint injections, soft tissue injections such as tendons. I use it to localize nerves to perform nerve blocks. It guides my regenerative medicine injections, my PRP, my bone marrow aspirate. It helps me target the nerves for peripheral neuromodulation or ablation. I have an M-Turbo ultrasound machine. It's a cart-based system, and we use it for very similar procedures as we use for the Clarius system, which is musculoskeletal, joint injections, nerve blocks, and spine. However, I don't take it with me to the ambulatory surgical center. It's not as portable, so it stays where it is. I will choose the Clarius ultrasound over the cart-based when I'm needing to do a peripheral nerve stimulator in an operating room, when I need to move from one room to another and I don't want to have to drag a large machine with me, or if I'm working in a smaller space where that machine may get in the way. Being wireless makes a huge difference in my workflow. Having multiple offices and going to the hospital, the Clarius unit will help me travel, be portable, not worry about wires plugging in. I just have to make sure it's charged and that I have my iPad or my iPhone with me and I'm ready to go. If I'm doing multiple injections or bilateral, the fact that there's no wire enables me to move quickly. I'm ambidextrous when it comes to nerve blocks, so I can easily switch hands, do the shot on the other side. If I'm doing bilateral genicular nerve blocks, that's 6 needles. 3 in each knee. So what I'm doing is I'm doing one side, I'm switching grips, and the fact that there's no wire involved makes it much easier. The Clarius units are way cheaper than most of the larger cart-based systems, and I think in this day and age it makes a lot more sense to get something on the level of a Clarius machine, where you have a portable and lightweight unit that you can do probably the same exact stuff with, that's a lot cheaper, and the picture looks just as good. I don't need to recommend Clarius at my educational programs because they come there, they see the Clarius, and they start asking me questions about it, and it catches their eye. It has nice design, it's very comfortable, it's lightweight, and the image is great. And they realize that it's probably a fifth or so of the price of the larger units, and they're getting almost the same thing. I'll just say one more thing, and I probably said this in previous webinars. Having Clarius and having the ability to send my images directly to an iPad, it's enabled me to create tons of material for education, for my residents, at my pain courses, and just to demonstrate what I'm doing to other doctors. So it's enabled me to convey that knowledge, and I would never be able to create the platform I created if it wasn't for having the Clarius system.